Welcome back to Good Day New York. So September is National Suicide Prevention Month. And this morning, we're putting a spotlight on the military community.
The organization Stop Soldier Suicide is the only national nonprofit focused solely on solving the issue of suicide among U.S. veterans and service members. Joining us this morning on Good Day to talk more about it is Stop Soldier Suicide's co-founder and chairman Brian Kinsella and Chief Product Officer Austin Grimes. Thank you, men, for joining us. We appreciate it. I'll start with you, Brian. You know, nationally, we've seen just death by suicide numbers increase over the last couple of years, about 50,000 Americans. It's really, though, prominent among people that have served in the military. Can you just give us kind of a number standpoint about the difference between everyday Americans and those that serve in the military and the statistics?
Sure, and thank you so much for being here. It's really great. And thank you for shining a light on this. One of the things that I would highlight right out of the gate is that, yes, the suicide statistics for men and women in the military are higher than their civilian averages. About 20 service members and veterans take their own life each day, and that equates to about 6,000 or so people every year from the veteran and military community. What I would share with you, though, is that it's really about the derivative impact, right? When you talk to a parent who's lost a loved one, right? They'll never forget it, right? And so of that 6,000, that impacts about 90,000 to 100,000 people. And so it's not just about the number of people that are lost, it's about the total impact of those community members and family members.
All right, Austin, so we recognize the problem, but how do we stop soldier suicide, as the organization says?
Yeah, it's a great question, and I think there's two facets to our organization, and one is the here and now of what we're doing today. So we have clinicians on staff. We have the entity is called Roger. It's GoRoger.org if there's anyone listening that needs help. Those services are 100% free and 100% confidential, and those lines are open all day, every day. So we are giving life-saving care on a daily basis, and there may even be a clinician on our team that's on a call right now with a veteran that is in crisis. And so we look at that, but we also know that that's not enough, right? And as Brian was talking about some of the statistics, we've got research that shows that up to 2/3 of veterans that die by suicide had no history of sharing suicidal ideation or thoughts with those around them. And so as we think about the statistics and what Brian mentioned of 6,000 veterans and service members dying each year, and that's been going on since 2001, there's about 4,000 of those who are walking around the streets in this country today who we just can't see. We don't know who they are.
So is it because they're too proud to kind of admit that they're going through problems, or there are just not enough support services out there for them to go to?
So there's over 40,000 veteran serving organizations in the country. There are a lot of resources. It's really about navigating those resources. One of the things that our team is really great at is helping those service members and veterans and their families navigate those resources. They could be mental health resources, substance abuse resources, or other things that exist. That's one part of it. The other part of it is that these issues compound over time. And so someone who may have deployed and had a steady marriage and was able to find a job when they transitioned out of the military, life happens, right? It happens to all of us. And as those things compound on top of post-traumatic stress or substance abuse or traumatic brain injury, whatever it is, that can lead to that person going down that bad path and suicide over time.
Austin, give us an idea of what the program does and how somebody can sign up for it right now.
Yeah, absolutely. So as I mentioned, Roger, GoRoger.org. The easiest way to access that is through the website. There's a phone number on that that will be answered if it is called.
And it's here in New York. You can get help right here in New York City.
You can. So we have clinicians around the country, and that is a one-to-one telehealth model, and it's suicide specific. So it's almost half of our clients, after they finish the program, have made statements that say that we prevented an attempt in their life. And so we know that the program is working. So I would suggest the website, the phone number there, and we are standing by. We're ready to help.
I think there's strength in anonymity. A lot of people are afraid to talk to people they know, that they love, because they worry about being judged. When they reach out to you, it's someone they don't know, so they can share some of these feelings that are coming out. So thank you so much for helping us shine a light on this. Stop Soldier Suicide is the organization. You can go online, find out more, and if you need help out there, just reach out. That's the
Brian
bottom
Kinsella
line.
and Austin Grimes, thank you.
Thank
and
you.
thank you to our men and women
Yes.
who do so much for us. For
Thank
our
you so
freedom.
much.
Thank
Thanks
you
for having us.